I'm very, very happy and excited to be able to welcome a prestigious and much honored panel here to my right and left. And I first of all would like to introduce Ilona Kickbusch, who has been co-chairing together with Gitinji Gitahi from AMREF and myself, the task force on global health. Then Peter Taylor from IDS in Sussex, who will be talking to us about the research and knowledge infrastructures within the field of global health. I welcome Rob Yates from Chatham House, who will be looking at the universal health coverage topic and dig deep, I think, also with the perspective on the Japanese presidency in the coming year. And I welcome Dirk Meyer, who is the head of Department 1. I might make a mistake. Yes, Department 1, on the department within the Federal Ministry of Economic Cooperation and Development of Germany that focuses, amongst other things, also on the topic of health and social security. So welcome to all of you. It's really a real pleasure of having you. And Ilona actually just flew in this morning from a World Health Assembly. So she had a coffee, you had a coffee, but I'm sure that the discussions will spice things up as well. So maybe let me just do a few introductory remarks. You've all contributed, many of you contributed to the issue paper and then also as part of the contributions through your policy briefs to the issue brief within the task force. You have contributed to the main recommendations that we try to distill out of the different policy briefs. Ilona will walk us through these in a minute, but I think it's important for us, if you look at the current situation, and the past months have shown this even more, to look at the situation of our world. And we realize that through the health lens, I think it's right to say that the climate health nexus and environmental change health nexus actually very much determines many questions within the field of healthy lives of the future. We have heat waves hitting India and large parts of South Asia, of parts of Africa. We have water shortages, especially in North Africa, in the Middle East, coming together with food shortages, which means that the import of food becomes less possible. Here, the conflict potential around questions of water increases. We have, of course, the shifting of climate zones that bring up the likeliness of zoonoses. We have the current discussions now looking at monkeypox that I think also reminds us of this increased risk. Second, we have, while we have these immensely increased challenges at the interface between human health and environmental change processes, we have a governance architecture that is within the field of health, just as much as within the field of environmental and climatic governance processes. They have been developed historically separately, largely separate within the context, with the focus on environmental questions and with the focus on human health questions. That means that at the interface between environmental and climatic change processes and human health, the governance system is underdeveloped, one should say, and fragmented. And we will hear quite a few aspects about that also here in a minute from Ilona. We will then look at what that means for basic universal health coverage and the further development also of monitoring and surveillance systems also at the interface between environmental change and health. And we will look at then the knowledge infrastructures. And let me, while we do this, also remind us of a third aspect that we touch on, but I think touch on a little too little actually in the communique. And this is the whole field of health literacy in our societies and also of our markets actually. Yeah? So the two additional core challenges when we look at the responses to the pandemic by now are low vaccination rates in many societies across the globe, nearly in all, one must say, that has not only to do with vaccine availability, as we all know, but also very much to do with the lack of demand, the lacking demand for vaccines. And that, of course, has to do with a low health literacy. I think it is a field where we also as a think tank community need to invest into, play a role in contributing to building awareness for the health risks arising at the interface between environmental changes and health, as well as for the potentials in the instruments in dealing with these here, vaccines as one example. And at the same time, I mentioned markets. Well, market shaping is, of course, a substantial challenge. We have a situation where we know that the development of production capacities, and I think Mr. Meyer will say more on this, is taking a number of systematic steps. But the question of how to make these steps survive the current situation of us slowly, hopefully moving into a post-pandemic situation is a core question. How to invest and assure that the infrastructures within the field of building up production capacities can actually move into a situation of post-COVID-19. Here, of course, also the question of workforce development. So these just as three general remarks. I would like to now immediately dive in, and I hand over to Ilona.
Well, good morning. And if I'm not too coherent, I got up at 4 o'clock. So I hope this will work. I've been asked also to give the apologies from the Ministry of Health. Whole team of the Ministry of Health is obviously at the World Health Assembly, where I've just come from, so they can't be here. And the other half is following up on the G7 meeting that we had last week. And so, of course, we have had quite a regular dialogue, and of course, it's a bit of a difficult timing that the health ministers and the development ministers meeting were actually in parallel with the publication of our recommendations. We did share some of them in advance to hope to influence the process. And actually, I would say one or two of the thoughts that we had developed have sort of found their way into some of the recommendations. I hope you get a chance to read our issue paper, but obviously also the very many policy briefs that were produced. Obviously, the issue paper takes on, the larger agenda, if I can call it that, whereas the policy briefs dig deep on a whole range of the very specific issues. And I think you will find a wealth of information there. We did two things that perhaps I'm not 100% sure, but I think none of the other task forces did. First of all, we said we can't talk global health without a representative from the Global South. And therefore, we approached Githinji Gitahi, as Anna Katrina said, to join us as a co-chair, which I believe really strengthened our recommendations. We also asked Githinji to organize a meeting with representatives of experts from low and middle income countries to comment on one of the first drafts of the issue paper, and 160 people joined. And we were able to use those inputs also to further clarify our recommendations. And this, of course, reflects one of the key values that we're starting to develop in global health, that it has to be inclusive. The global north cannot define the agenda that is important for the global south. Those are the only terms we have right now. I know they are also being discussed, obviously. This is very important because we also, for our paper, developed a kind of chapeau saying, you know, what does the G7 actually mean in these days also for health? Just a year or two ago, a number of people said, close it down. It has no relevance. But with the Ukraine war and other developments, it's become clear that the group of 7 major democracies in the world with a certain set of values and, of course, significant resources at their disposal can make a difference if they choose to do so. And I think if you look at the chapeaus of the recommendations actually from the G7, you can see that this thought has been taken up very, very strongly. We structured our issue group around these 3 foci, the values on the one hand, the investments that are necessary, but also the transformations. And we said that anything that the G7 countries propose or do on health must be embedded in a strong commitment to equity, to inclusion, and to solidarity in all partnerships with low and middle income countries. So we also try to move away from something that is clearly happening, and we'll hear more from the development ministry on that the old type of development policy for health is out of date, that something new is developing, and that we can see from the recommendations also of the formal G7 meetings that the G7 countries are grappling actually with such a new approach and trying to propose it and move it forward. And that also means, in terms of our second point, investments, that quite different types of investments are made. We'll hear about investment in production sites. We'll hear about investments in research cooperation. We'll hear about investments in networks, in hubs, in a different kind of networked multilateralism rather than the old way of doing things. And that's also, and Anna-Katrina has already alluded to it, part of the third dimension, moving from investments to what we called transformations, is to say that the health agenda itself is changing. And therefore, the One Health approaches, the interaction of health and environment, climate change, the health in all policies, whole of society approaches that are necessary are part of this transformation. And I believe digital, of course, as well. And I believe some of those are reflected, and you will also find them in our recommendations. What we were very keen to put forward is actually to propose that the G7 should move away from each of the G7 countries setting their own agendas again and again. And that it should be more coherent in how it approaches its work, which is why we suggested a Global Health Compact 2030, suggesting that the G7 countries agree on a set of priorities they want to address in the course leading up to 2030 and the Sustainable Development Goals. And it was actually interesting to see, if you read the recommendations of the health ministers, that they have agreed to a little bit of that, if I can say that, because they are working on a pact, a G7 pact for pandemic readiness. Also something that goes beyond just, in quotes, the German presidency. It's something that includes some of the recommendations of the UK presidency, like the 100-day challenge and issues of that nature. And the various approaches to readiness are also reflected to some extent in what we have proposed. Of course, in terms of delivery, it's very clear that one of the key priorities is in terms of equity to fulfill the existing promises. I'm sure we will hear more about that around the last mile delivery of vaccines, the aim of ending the pandemic, but also, again, I refer to the readiness agenda to make sure that we put infrastructures into place that will actually prevent future pandemics. And this notion of infrastructures, of course, was one that was set by the overall presidency. And we wanted to make sure that when people talk about infrastructure, they also think about health infrastructures, and also not just infrastructures for pandemic prevention and preparedness, but also of universal health coverage, which we will also hear. Two more issues I'd like to highlight. We've seen a tendency in G7 and G20, which I'm glad to say this presidency does not seem to follow through on, is that there is this urge to create new institutions. You know, there seems to be a feeling we've only really done something in the G meeting if we've created a new institution. And so we argued strongly against that and said that if anything, the G7 as the major donors who actually sit in the decisive boards and governing bodies of all these respective institutions should actually come together, consciously work against this fragmentation, and also in terms of financing, develop a model that is not a competitive marketplace as we see right now, but is a much more sustained investment in global public goods. And so we've suggested two mechanisms rather than institutional setups. One, an infrastructure task force to give effect to the G7 Global Health Compact priorities that we see reflected in the many policy briefs that we have. We see part of this, the financing of the World Health Organization, which has always been a German presidency priority and is, of course, an issue at the present World Health Assembly. And we have suggested that as major donors, the G7 countries should initiate an interagency standing committee, we have called it, on global health, that would work to counteract the present fragmentation. And we feel this is very important, and maybe the pact can be a first issue along those lines. There are many other details in what we proposed. I won't take up much more time, except to say that we did suggest that next year, while this year there have been meetings of health with finance ministers, meetings of health with development ministers, that next year possibly there could be a meeting of health and foreign ministers, given the role that health is playing in geopolitics. And that the whole approach, and this is the last thing that I'll highlight, is that the G7 obviously needs to enhance the trans-regional dialogue to achieve the various health targets that are set. And that takes us back to the networked and inclusive multilateralism that we have suggested. So despite my early rise, I hope I've made some sense.
Thank you, Ilona. I think we can do clapping in between. Thank you. And we will immediately move on, and we will move on and over to Peter, then to Rob, and then to you, Mr. Meyer.
Great, thanks. So I'd like to highlight in this short presentation the need to pay attention, coupled with resources, to strengthening the infrastructure for research, evidence, and learning that promotes and improves global health.
Is your mic on? Sorry.
It's coming now.
For the virtual.
Yeah, okay, there it is, thanks. So why is this important? Well, we know, of course, that COVID-19 has put the lives of millions of people at risk. As we heard yesterday, it's created uncertainties and heightened existing fragilities, particularly where social inequities and inequalities are most pronounced. And we also know that global health requires equitable, inclusive responses. Many of, again, we heard yesterday and are recommended in the policy brief and the issue paper. And these are essentially informed by research, data, and evidence. And we've seen the dramatic generation of vaccines through collaborative science in ways that I think were probably never seen in quite the same way before the current pandemic. But we also know that existing global health research infrastructure is afflicted by weak institutional mechanisms. There are evidence hierarchies and silos which privilege and prioritize some knowledge over others, and some of those exclude and devalue different kinds of knowledge and lived experience. So how do we challenge our assumptions about what's happening regarding health in local contexts unless we hear the perspectives of those who are directly affected and learn together with them? And too often the voices and perspectives of people who are poor and marginalized are ignored. And we've heard again yesterday that dealing with uncertain futures and complexity is our global reality, and robust sustainable responses will require diverse plural perspectives sourced from across a currently fragmented knowledge and evidence landscape. Well, what causes this situation? In our policy brief, we identified three major challenges. Firstly, it often comes down to the money, insufficient financial support to global health research, evidence generation, and learning. But there's also insufficient investment in the infrastructure for promoting international learning and exchange of health-related knowledge, evidence, and data. And fundamentally, a challenge that policymakers often are engaging with too narrow a range of evidence. And this creates echo chambers and missed opportunities to think outside the box and to learn from those whose experience is critical, but is often overlooked. So in our policy brief, we highlighted 5 main recommendations for action by G7 members that we felt would help to address these challenges. Firstly, again, about the money, a jointly negotiated quota of G7 members' national GDP for research and development funds administered through multilateral channels, and a significant proportion of this funding dedicated to health-related research. We also want to really address this challenge of fragmentation. And so we recommended establishing a centralized health research clearinghouse with joint governance for communication and action to help avoid that fragmentation. And then also we recognize that so much evidence, knowledge, and experience is residing in regions of the world who often are not being accessed globally. And so we also recommended the establishment of pandemic centers of excellence in all world regions, and they could provide collaborative regional mechanisms for medical research, but also importantly for social science research relevant to health and vaccine production, distribution, and delivery. We also would like to see G7 members committing to collaborative research networks that represent different forms of knowledge and experience and use a diversity of research approaches and methodologies, including participatory research. And finally, fifthly, investment in adaptive, agile national and regional systems for monitoring, early warning, and crisis preparedness, underpinned by open data and digital utilities. Again, we heard yesterday that unless we're monitoring these, both the investments and the outcomes of our efforts, how will we actually know what's being learned, what's actually happening on the ground, and then feeding that back into a global system of knowledge? Now, we accept that, of course, achieving these actions are not easy, but we can't take our eyes off the ball and believe that we're done with the pandemic. You know, soon people will be saying COVID-19, so last year. There will be more pandemics. They are coming. We know that they will come. In what shape or form or when, we don't know, but we can be sure that they will, and we need to learn from this one. And we know that G7 members are in a very powerful position to help eradicate the inadequacies of current research, knowledge, and learning infrastructures. And we also know that G7 members' investments in science and research do benefit individual nations and the world, but these benefits are not distributed equitably. So current science and research arrangements constrain a collective worldwide ability to address multiple challenges relating to and going beyond global health. So to gain the best value from G7 member research investment, in our policy brief, we stress the importance of accompanying high quality, credible, robust infrastructure, which would allow joined up learning from a far wider body of knowledge and experience than has been engaged with in the past. In the short term, this would really require G7 members to review their financial allocations to science and research that relates to global health broadly. As mentioned yesterday, we also really encourage G7 members to join a global call for action to get some commitment, momentum, and catalyzing change, spearheaded by the UN, again in close collaboration with G7, G20, private sector partners, and other international actors. And we propose the idea of a UN decade for health research. And this initiative will support pandemic preparedness through combining health and social sciences with knowledge on preparedness from below. This is an expression that in our work at IDS, we're using quite a lot. And that's really referring to the understandings, experiences, and practices of communities through which they are anticipating and managing disease threats on a daily basis. And G7 members could also explore the idea of establishing a working group to lay the groundwork for establishing the centralized health research clearinghouse and the pandemic centers of excellence. And we believe that these actions are urgent and they actually could be addressed quite quickly. But we also recognize some actions will take longer. And in the midterm, we'd encourage monitoring and publishing data on financial allocations to research. And also, of course, through this agreed percentage of research spend via collaborative networks that include not just funders, but multilateral institutions, private sector, and researchers who bring different kinds of knowledge and experience to tackle these complex interrelated global health challenges. And we would like to see an agreed percentage of this funding for exploratory research, because we need to be agile and adaptive. We have to deal with uncertainty and complexity, which means you can't plan and predetermine everything in advance. You have to have that agility and flexibility to respond. And on a more continuous basis, we'd really like to see G7 members fostering longer-term political dialogue at the global level to create the political will for valuing science and research. This term political will comes up a lot, but without it, we know that some of the most intractable challenges just won't shift. And this is really to work across and integrate disciplinary approaches and to invest in those, to see it's worthwhile and to see the practical use to do this to address national, regional, and global health challenges. And this may involve G7 members participating in the global governance and resourcing of a robust and credible science research and learning infrastructure that promotes global planetary health through equitable distribution of knowledge and learning. So there's a real opportunity here to ensure this inclusive global health research and evidence infrastructure can be created, has a sufficiently wide evidence base, that there's support to learning, which facilitates exchange of knowledge and experience. And we really feel that these actions would be an inspirational act of leadership and commitment, and fundamentally help to address some of the world's most pernicious health challenges, whose impact is always felt by those who are already left furthest behind. Thank you.
Thank you, Peter, for underlining that if you want a joint health governance system, and we don't only want it, but we need it urgently, we also need a joint knowledge base and expertise base. And joint doesn't mean a monoculture, a knowledge system that is determined by few only, or in which the standards are determined by few only, but where diversity is exercised and lived. I think that's also something that points, of course, to your educational focus in your department, Mr. Meyer, and reminds us of the importance of linking state governance systems with non-state systems, and informal governance practices. And I think there's also a clear bridge to your input, Rob, to the universal health coverage topic, and I would hand over to you.
Absolutely. Thank you very much indeed, Anna-Katharina. Greetings. Yes, the last time world leaders got together to really talk about health at a head of state level was the high-level meeting on universal health coverage in September 2019, obviously just before the pandemic, where loads and loads of heads of state were standing up talking about universal health coverage based on rights and equity, and everyone getting the health services they need with financial protection. Little did we know how badly exposed we were going to be to the pandemic, and how every single health system in the world has shown its limitations in achieving that goal, both within countries and between countries, because universal health coverage, of course, is all around solidarity and healthy, wealthy people subsidizing services for the sick and the poor. But I think, if anything, it really has doubled down the case for universal health coverage. And I think exposed, again, I think the weaknesses maybe that we weren't really giving enough attention to the public health services, the pandemic preparedness. There's been a tendency to think of universal health coverage as about individual services, people getting hospital treatments and things like that. But it's absolutely crystal clear now that the response to the pandemic and preparing for better ones is greater commitment to universal health coverage. Again, within countries and between countries. The question is now, how do we reinvigorate that agenda? And I think very much there is a view of a good many people that this is the best approach to build back better in the health sector, to really double down on universal health coverage as the really smart thing to do. And where the G7 have got some really good stories. I mean, the issue around the financing of universal health coverage is all really around socializing your health financing system. That's a pivotal step. And you might say that started here in Germany, the approach of social health insurance, started here. 6 out of the 7 nations of the G7 have cracked this. They realize the importance of socializing your health system at different times. The one outlier perhaps is the United States, but of course this is an ongoing process, and the US may well get there as well at some point. But I think that you are seeing, many G7 countries recognizing that this is a very sensible approach. But then how does the world double down and move towards universal health coverage? And I think this is where there's this huge debate now in global health about what should be done at a multilateral level and what should be done at a domestic level. And I think this is crucial for prioritizing health spending going forward. And you're very much sort of seeing now a sort of a thinking that, sort of given the real politique of where we are at the moment in terms of aid financing, that maybe multilateral financing really should be concentrating on the global public goods and services that the world depends on, and sort of thinking about investing in R&D for vaccines. I would say the World Health Organization is an absolutely fabulous global public goods service, and they're really making sure that these things are funded very, very well. But when it comes to financing universal health coverage at a country level, being realistic, we are talking about that being domestically financed. There are so many sort of countries, particularly low middle income countries, that are only spending about 1% of their GDP at the moment in public financing. They're a long way from universal health coverage. But thinking about big countries in South Asia and sub-Saharan Africa, at the end of the day, aid financing is not going to make a substantial difference to universal health coverage in India, for example. But I think there is a tremendous opportunity to use this crisis to catalyze big increases in domestic financing in these countries. We've seen throughout history, interestingly, that so often it is big crises that catalyze universal health reforms. That was certainly the story of my country. But in fact, 3 of the G7 countries launched their universal health reforms coming out of the Second World War, when they were basically bankrupt and dependent on US aid, interestingly. But then you've got countries like Thailand launching big universal health reforms after the Asian financial crisis. Rwanda very successfully launching big universal health reforms after the genocide. So much as it might sort of seem optimistic to be thinking this, I think this is a great opportunity for us to be really encouraging countries to step up and finance their health systems properly, using domestic financing. But again, where I think the G7 can play a very, very important role, looking at their own history and very much encouraging this approach. And really congratulate Germany for putting this on the agenda. Japan have been huge champions of universal health coverage, and they've had summits that their prime minister has hosted in the past. So very much hoping that the G7 are going to stick with the UHC agenda, and this transition from Germany to Japan will really follow through on that. Unfortunately, the UK government haven't been on as strong as this on the last 10 years as it ought to have been, but who knows, things might change in the future, and we'll sort of get back on course in the UK as well. But I think the G7 really looking very rigorously at where multilateral financing is going to be best spent for the health of the world, but also playing this catalytic role in encouraging countries to really step up their domestic financing would be a truly valuable thing to do. Thank you.
Thank you, Rob, for reminding us of this crucial importance of UHC, but also of the aspect that it cannot be financed through aid funds only. So I think it's an important reminder of the fact that the G7 here in this field has to play also the role of an advocate, one could say, of bringing in its political capital in shaping discourse spaces and encouraging strategy formation, strategy building through alliances and through alliances within the G20. So I think that's an important example in many ways, where it's not just about finances, it's not just about another financial pledge, but it's about political capital that is mobilized in order to develop, to invest into strategy building. Mr. Meyer, I think there is the direct bridge to you.
Yes, thank you very much. I'll try to pick up some of the points I heard and try to say what in our ministry the approach together with the health ministers actually is. First of all, when I start, I'm very often a bit astonished about the last 3 years in my own ministry. In 2019, the predecessor of Minister Schulze was of the opinion that global health is not yet the topic of a development ministry. And in our own matrix, where we deliver our budget, we kick the topic out. So it was just on a bilateral level, but it wasn't part of the DNA of development policy 2019. And one of the first decisions Minister Schulze took when she came to power in December was to put it back into the matrix. So that just shows what kind of learnings are behind us. And I don't want to blame the former minister. It was some kind of common sense that it is not as important. So what we realize, in my opinion, is that COVID was one of the biggest learning machines we had in the last 10 years. We learned, just to mention a few topics that were already just mentioned, we learned what could be an agile way of managing crisis, which is very important. Coming from a Prussian-formed ministry system in Germany with a lot of silos, it is very hard for any kind of administration to act agile. And in a way, we learned agility for the first time. Secondly, to see the topics in a holistic sense. You all mentioned that already. That is also new, and it comes to the point how to break the silos, which is very complicated. When you like me work in the machinery room of a ministry, it is very difficult. We learned, of course, that a health crisis has a huge impact on all other fields of politics. We see as the learning in the learning machine, the growing inequality of gender inequality. We had so many setbacks in the development policies over the last decades. We see and saw that science-based politics in combination with agility is one of the crucial ways of acting in the political and administrative sphere. And to pick up the G7 point, it's also a learning. Together with the war on the Ukraine and the shaking of the G20 system and the UN system, we suddenly realized that G7 could be a very strong acting point again, and regional institution that is being able to act. And I'm also dealing with the food security crisis, and there also the world looks on a G7 and its leadership and we built this alliance on food security. So it's really a huge learning system. We are still not over with our learning, but we are on the way not to waste this crisis. And that's the first point I really want to make and to stress what all the others already said. One other major learning, of course, is that we have to be much, much better prepared and identify what went wrong. The evaluation, which is done at the moment with Act A, is also very important for us to see what went wrong and what went well. And we all know that we have to prevent ourselves for coming pandemics. That's what you all stated too. It's not the question whether, but the question when the next will come. So it was very good for me to see, coming from the BMZ, that the back-to-back ministry meeting of the G7 with health ministers and development ministers, and the paper of the Task Force Global Health from Think 7 are very close together. I mean, many things I heard from you are really very like-minded to what we stated, although maybe not everything is in the communiques, but the thinking also between the experts in the ministries is very much like-minded. So let me just very shortly stress through 3 key points. The first is, you mentioned it also, we need to end the pandemic now. That's also very important. We are still in the pandemic and in the midst of the of the crisis. So you're absolutely quite right that we have to ensure equitable, sustainable access to safe, effective, quality assured and affordable vaccines, therapeutics and diagnostics. That's the key sentence, I think, which is still absolutely crucial for being in the pandemic. And therefore, we are proud in Germany that when it comes to Act A and financing the next phase, that we financed already according to the fair share, that we finance also the efforts in the last mile initiative. Fortunately, we now have enough vaccines, but they have to come into the arms. So that's a strong effort, which is still to be managed. And another aspect that is then lasting to the long-term learnings, we are very much engaged in building up local vaccine production on the basis of the mRNA technologies. We have BioNTech with their projects, but we also support the hub in South Africa. And you are absolutely right. The next crucial point to think about is how to build sustainable business cases for that. That's a very, very complicated question. We just had it in our task force and discussed it. We have to be aware that this is a crucial point and that it has probably a mission between state-funded and private efforts to be made for such a model. I'm getting confused here. So my second point is, as you said, we have to strengthen the health systems, and that means the universal health coverage and the adaptive social protection systems. And therefore, I wouldn't just be happy if we have the next G7 meeting between the health ministers and the development ministers, but also between the health ministers and the ministers on social affairs, because you're quite right, which is also a very complicated aspect to build up social protection systems. Actually, this is also an aspect where I'm very happy that we have this kind of debate now. I mean, we just left the neoliberal phase in the world, and social protection was a kind of coming from the devil itself, that we are now talking about this, and that we learned and see that countries who actually had even a minimum of social security systems went much better through the crisis than all the others, is another big learning that demands us in building up these systems. we have to find the real ways. And if it comes to the national funds we have to build up, we see, of course, especially in the countries who are in our sphere, low and middle income countries, that in combination with the multiple crisis and in combination with the food security crisis, we have a debt crisis and we have an acceleration of big problems in finding right answers. I see the micro on my left. So the last point, of course, is, let me just stress this, we need much better prevention and preparedness structures rather than immediate responses. And therefore, just to stress 2 points, I'm glad that the health minister is now on the way for a pandemic treaty. And secondly, that since the Biden summit a couple of days ago, we have the announcement of a fund for pandemic preparedness at the World Bank, together with a strong role of the WHO. And that's also a very big point, that we have to strengthen the WHO, and that G7 is actually in its communiques very much underlining this point. So I make a full stop and maybe we have some more time for discussion. Over.
Thank you so much. And we will do exactly this now. We will do one round. So please put up your hands now. And then we will have one last round here from all panelists to basically respond. Yeah, I apologize for this, but time is tight as always. So please, the colleague, yes, you go first, and then we go around the room here. Yeah.
Hello, everyone. My name is Bamba Dama. I come from Cote d'Ivoire, and I work with African Union Commission as Africa Youth Advisory Board on Disaster Risk Reduction. So I'm really pleased to listen all what you said. I think we got a challenge during the COVID crisis. You know, in my country, we got also some case of Ebola during the COVID crisis, and we have been able to tackle the Ebola one, and we are still trying to see how best we can tackle the COVID one. So I'm really wondering if there is a kind of strategy that is developed by G7 to see how best at national level we can have a multi-hazard early warning system. Because if we just stay on COVID, it won't work. For developing countries, for sure it will not work. The case of malaria is we have more death from malaria. I think it's more than 400,000 deaths in sub-Saharan countries. But for COVID, we got less than 30,000 deaths. So if there is not a kind of multi-hazard early warning system, it won't work. Please, I'm wondering if there is a kind of strategy and discussion about it. I know Italy is already supporting EU to establish an early warning system at continental level, on regional level, but at local level, if there is no early warning system, it will not really work.
Yeah.
Thank you.
Thank you. Mylene, then Luis, and the colleague.
Meilin Fang, People-Centered Internet, based in the US, and also originally from Singapore, which in fact has a case management system from the social side to the medical side. That's a side note. I was the social technical lead for the US Department of Defense for the future of health. And there is appetite in the US for the public health investment. So while there are political issues on the universal health coverage, the public health side is quite open. So I want to put for consideration the digital tax, which the G7 has already proposed. Everybody knows we're going to have lots of trouble collecting it. But what about we apply that digital tax to transnational health, public health? That the tech companies which are under public backlash right now could actually put the first 1 or 2 years of the digital tax to transnational health. And then after that, the systems are all set up, and then that could be an ongoing thing for 1 or 2% of the 15% to continue that. So I put that forward.
Thanks, Mylene. Please.
Good morning, everyone. Thank you very much for the whole intervention. So my name is Luis Pizarro. I represent today the think tank based in Paris, Santé Mondiale 2030. I just wanted to highlight something we didn't mention, but has been in the past in the G7, that it's human resources, because we're talking about a sustainable health system. We're talking about universal health coverage. And of course, it's absolutely key, but nothing will be done if we don't invest in human resources. Hopefully, we published also a paper, policy paper here. So it's good, I think we have in mind. And it's also good because it moved beyond this north and south approach we used to have in the past. And we see together that human resources is a real global health issue that need to be addressed in a new way of thinking, as Sidona said at the beginning. Thank you.
Thanks.
Hello, good morning, everyone. I'm Tim Heinemann. I'm working for KfW, the German Development Bank, and I'm managing the vaccination project in South Africa Dirk Meyer talked about. And I enjoyed a very interesting aspect, a link between sort of the three comments the panelists made, the link between universal healthcare, diverse knowledge, and vaccine production. And the first maybe comment I would like to make is in Germany, we talk a lot about mRNA vaccines, of course, but one of the truths about the diversity of knowledge is that, of course, we have to accept there are other techniques. And the project actually the BMZ is funding in South Africa is about developing a plant-based South African-made vaccine. So that's about the diversity of actually in order to be prepared for the next pandemic. I think that's crucial to have a sort of technology openness. And the other thing is, that is sort of our worry when we look at the developments, especially on the African continent, is will these advancements actually last in terms of, will there be enough commitment to buying local vaccines? Will African states actually pay a premium for locally manufactured vaccines? And that, I think, links up with the access to universal healthcare and having the resources to basically buy these vaccines. And then it comes back to knowledge again. Will the African population actually accept and buy and use vaccines made in Africa? Or will we have, when they have the trade-off between a Western-based vaccine and an African-based vaccine, will the sort of Africans then say, oh no, actually I will go for the Western one and not for the locally produced one. So this is a particular challenge we see, and we would be interested to see what are your answers, if you have any. Thank you very much.
Thank you. I apologize, but with a look onto my non-existent clock, so to say, I have to close the list, and I would now invite all panelists to, you can pick and choose a little which questions you will respond to. Please keep in mind, we have basically 4 going in different directions, and we start with Peter.
Great, thanks. I think one of the key things about learning in the context of global health is the need to really have an infrastructure which supports it and encourages it and promotes it. Ebola is an example of a case where many African countries actually were able to tackle the COVID pandemic better because they had learned from grappling with Ebola. And those lessons were learned in those African contexts. Those lessons were not necessarily learned very well globally, which really indicates that challenge of sort of bringing those lessons and those different experiences up. In terms of financial resourcing, I think the digital tax may well be an opportunity for digi companies to be able to contribute financially, because in the end, they work with knowledge. And if we're thinking about really engaging in knowledge issues around global health research and learning, then that may be sort of quite an appealing connection for them to make. Human resources, yes, absolutely. I mean, the ability to learn effectively, as we heard from the German example, depends on capacity and capability being in place. And that differs from context to context. And so this resourcing in terms of supporting knowledge research and learning infrastructure also depends on those capacities and capabilities being there. I would just finally say that I think one of the core things that really struck me during the pandemic in the UK is the public appreciation of the importance of research. For the first time ever, we have daily briefings with the chief medical officer, with the chief scientific officer, standing next to the prime minister or the minister of health, showing graphs and data, and people watching it and actually beginning even to understand it and appreciating it. And I think that's another of these moments of opportunity, that COVID creates. It's a crisis, but it's allowing this appreciation of evidence-based policymaking to really be a force for change, rather than perhaps the policymakers' preferred model of policy-based evidence making, which has tended to be perpetuated in the past. Thanks.
Thanks, Peter. And I hear a lot of agreement in the room, but I also invite those panelists here, if you want to point out to some controversies, they are very much welcome. Yeah, also some critical feedback. Ilona.
Well, just a couple of points. I think countries, G7 and also the World Health Organization are moving forward very much with the multi-hazard approach that you have promoted. And of course, the WHO Hub on Pandemic and Epidemic Intelligence that has started its work here in Berlin is working with many of similar institutions around the world to start to develop exactly that. But that has to be linked to a new type of research infrastructure. And, you know, doing that kind of early warning system that's multi-hazard can no longer be based on traditional epidemiology only. And we have learned how much social science knowledge, knowledge on mobility, all kinds of other data are absolutely critical, knowledge about the beliefs of communities, etc. And therefore, I think we have started to learn about the importance of science. And there's two sides to this science. On the one hand, we've seen that the science literacy of the population is becoming more and more important, and we have undervalued that. And the infodemics have, of course, partly been due to that, also that they're so successful, because we do not have populations that have actually learned systematically to think with science in mind. So health literacy increasingly is not only related to digital literacy, but it's related to science literacy as well. And I think we need to look at that. I'd just like to mention that some new forms of science cooperation, also if we call it multi-hazard or One Health or whatever, is being developed, that there is some very intense thinking right now, whether in the health field, in the global health arena, we should not have a similar mechanism as the IPCC. And there's very serious thinking about that. We have been discussing it in the Global Preparedness Monitoring Board. I know it's being discussed internally in the World Health Organization, also with a range of member states. And this uplifting, if I can call it that, of science is very important. Just two more other things I want to say. We have learned that regional organizations can play an incredibly important role. And, you know, the new cooperation also between the European Union and the African Union will be absolutely critical and essential. And also last week, we heard that the European Union is now reworking its global health strategy. That can have a tremendous impact. Some of you will have heard of the so-called Brussels effect, that if the European Union also starts to regulate something, and I'm also thinking of your comment on the digital tax, if something, you know, if the major trading bloc in the world decides to do something, it has an influence on everyone else. My very last point, where perhaps there is some difference, and that is, but you mentioned it because it's not clarified yet, is in relation to the FIF, the financial fund, how much WHO will really be involved. Some of us are highly critical of a new fund that would not have WHO as an equal partner, and there are still pushes to do that. And anything Germany as the G7 chair can do against that to make sure that this is a joint enterprise of WHO and the World Bank, and is not an either or between financing WHO and financing the FIF, I think is very, very important.
Thanks, Ilona. I realize that Mr. Meyer has to leave in about 1 minute, unfortunately, so please.
So I'll make it very short. Thank you very much. I just stick to 2 points. The first is, I'm not a tax expert, but to stress your point, I would say when it comes to health architectures, we should look on public money and not on philanthropes and things like that. So a strong emphasis on public money by taxes. So that's the one thing I would like to stress. And the second one, from the colleague from the KfW, your comments just showed how complex this topic is. And that's why in the TRIPS waiver discussion, I always tend to say we are not talking about fast food restaurants, but we are talking about vaccine productions, which is a very complicated ecosystem we have to build around. And it means that you have to have stable governmental institutions with a strong political will to support this. And that's absolutely necessary, which we see already in the projects. And we support this from the BMZ, but this is crucial. So I underline what you said. Over.
Thank you. And can you listen to Mr. Yates? Yeah.
I really like the questions because I think it exemplifies beautifully the case for universal health coverage. You all address slightly different systems issues, you know, sort of be it around public health services, and it needed to be multi, threats, not just one. So yes, completely. One has to look at all those. Likewise, with the issues around human resources, absolutely imperative you get the human resources right, both within countries and looking at international labour markets for human resources, you know, sort of definitely. And also the whole issue about commodities and vaccines, and are you going to pay a premium for African produced vaccines? These are all difficult questions. And then you brought up the health financing thing, Milan, you know, sort of about how are you going to pay for this potentially out of a digital tax. And I think this shows beautifully that we need to do all these things, and how much of it is dependent on public financing. But the key to all this, and a number of people mentioned it, is political commitment. How do we get the political commitment? And I think this is where perhaps we're not often very good in global health at talking to politicians about why they should do this. And perhaps we're not that much clever about sort of selling. Our biggest selling point is that universal health reforms are very, very popular. You know, sort of go route one, because in many respects, ministers of finance are often reluctant to do these things. They don't like spending money on health, a lot of ministers of finance. But if we can be smart and go to a head of state level and say, look, you could do all these things and you're going to look really good and potentially get re-elected, then you get their attention. So I think that and I just one final plug, we are setting up a commission at Chatham House to do this, to try and inspire and encourage a new generation of political leaders to launch UHC reforms that will potentially tackle all these things at the same time. Thank you.
So thank you, Rob, and I would like to thank all of us, all of you, for contributing to the different policy briefs, issue briefs, to the communique, for listening and engaging with us. Do read the communique, do read the issue brief of the Global Health Task Force. I think the discussion now has shown we are moving and policy making is moving into quite a few directions that also we've been discussing within the think tank community. And nevertheless, there are a few areas where we need to push substantially further, a mid to long-term perspective in UHC, need to invest into building the knowledge and governance interfaces, need to think about workforce development, need to think about the sustainability of building up production sites, etc. And of course, investing into a strong multilateral health governance architecture, here particularly into the WHO. And with this, I'll end. I thank all of you, especially all panelists.